Wish me luck. Setting up your meeting for live. So it says that we're streaming live, so fingers crossed that works. Okay. Great. Okay. So I will begin with this journey through the anatomy of a singer. Welcome to those of you joining on Facebook. If you would rather join the Zoom chat, you can actually go to the St. Paul's page and find the link under the most recent post for the webinar leaflet on anatomy of a singer. As I said, welcome everyone. Thank you so much to Tricia as well and St. Paul's Opera for giving me the platform this evening. I'm really excited to be doing this. I'm combining my two passions. I've just come up with the idea randomly recently and asked Tricia if she would allow me to do this, and she has been very kind to do so. And my two passions are the human body and anatomy and singing. So my background, first of all, so you know who I am and why I'm talking on this subject. I'm a chiropractor. I work locally in Clapham, and I've been working as a chiropractor for 10 years. Prior to that, I studied human anatomy at Cardiff University at undergraduate level, and then I did my master's in chiropractic. I graduated to London and I've worked here ever since, and I specialize in the management of spinal conditions, but I've also done extensive postgraduate training in exercise rehabilitation. And more specifically and relevant to singing, in my experience, I've studied a form of spinal rehabilitation called dynamic neuromuscular stabilization, or DNS. Everything has a long name in my chiropractic world, which I'll touch on briefly shortly because there's a lot of overlap between singing and what I teach my patients actually who have low back pain. So I found that very interesting whilst I was becoming a singer. And I've also studied courses in the management of jaw conditions, which can often cause problems for singers, jaw tension. As a singer, I'm sure my dad will laugh because every journey for every Welsh child's journey starts in nursery, primary school, where singing forms a standard part of every day. Throughout the day, we've taught through the medium of song and learn about almost everything and anything through singing, which helps to memorize things, I guess. And I would compete in the National Eisteddfods in choir or as a soloist up until the age of 18. And then I stopped and started studying to become a chiropractor. But when I was 30 years old, I treated a classical singing teacher as a chiropractor, and she had a bad neck. And to thank me, she offered me singing lessons, and I was hooked straight away, as many of us become. But what I interestingly noticed immediately was that many of the concepts that she was teaching me, I was actually teaching to my patients in a very different way, which might surprise you. So good upright posture and the relationship between having good upright posture and less tension in the body, very important for breathing, for singing. And abdominal and diaphragmatic breathing, I would also teach to my patients as well, because the diaphragm, as I'll talk about it shortly, is not just a respiratory muscle, but it's actually a postural muscle. It's part of what people call the core, or those deep spinal stabilizing muscles. So it's important for back pain that you're breathing correctly, which might surprise many of you. And then how to activate those core muscles. So strengthening those muscles that protect the spine was also something that I would work with my patients on. And also as a specialist in jaw problems, I would also be able to relate to jaw tension as a problem with singing. So there was a lot of overlap, I found. So anyway, that's how I've taken these two subjects and decided I think there's a lot of stuff I can bring together there that hopefully you'll find interesting today. As I mentioned before, there will be a question and answer session at the end. So if you have burning questions, I'll stop and answer them. But if you are happy to wait, it might be the case that I'm going to answer your question just a few minutes later. So if you still have the questions at the end, just write them down and I'll answer them then. So I really hope that those of you who are interested in singing or are singing that this webinar helps to demystify some of the often metaphorical language used to describe the mechanics of singing, which can be often abstract and confusing for some, and to bring a little bit of clarity to the complex process of singing, which involves the whole body, really. And I do have to make a little disclaimer, which is the fact that I am not a singing teacher. I'm not here to teach technique. I wouldn't know where to begin. I'm not a vocal coach. I am speaking from a musculoskeletal perspective as a health practitioner. So just try to remember that if you are a student of singing and anything I say might conflict with something that you think your teacher has said that might disagree with me, if that makes sense grammatically, ultimately your teacher's advice wins the day. Okay, so, and if you're unsure still, I'm very happy to speak to you afterwards. So with that out of the way, let's begin. So a bit of introductory stuff first. I'm going to show you some images, of course, as well. It's going to be quite a graphic journey. Making a musical sound requires 3 ingredients: a generator, a vibrator, and a resonator. And that's true of any musical instrument. The generator is something that causes movement. That movement then causes the vibrator to vibrate, and then something usually in the region of the vibrator increases this vibration and amplifies the sound. And that's known as the resonator. For example, if you think about a guitar, the generator would be the finger plucking on the string, and that causes the string to vibrate, and the whole body of the guitar resonates and amplifies that sound. Well, the human voice is also produced by a combination of anatomical regions, which are collectively known as the vocal apparatus or machinery. And the vocal apparatus can also be broken down into those 3 functions: the generator, the vibrator, and the resonator. Now, I will be showing you these, of course, shortly. So that first function is that of the generator, and that's the respiratory part of the vocal apparatus, and includes, of course, the lungs, but also the diaphragm and the accessory breathing muscles. So there are other breathing muscles that we need to use when we need to take extra big breath of air in, and the abdominal muscles. These generate the movement or the flow of air, and then it's this air that then reaches the vocal folds within the larynx or the voice box, which form our vibrator mechanism. And as the air pressure builds up underneath the vocal folds, they start to separate, and as they open, a puff of air passes through. And then that puff of air then sucks the cords back together. And that suction is known in physics as the Bernoulli Effect. And that happens when objects are pulled together by air passing between them. And it's the same thing that causes a lift on an airplane wing, actually. There's a change in air pressure around the wing, as some of you will probably know. Following that, those vibrating puffs of air that come through cause the surrounding tissues and passages to also vibrate and resonate. And these are our main primary resonators. And in the body, these are the pharynx, the mouth, and the nasal cavity. And again, there'll be more on that shortly. The shape of your individual resonators, so your human anatomy, your individual pharynx, mouth, and nasal cavity, is what dictates then the quality and the amplitude of the sound that you make. Which is why, of course, everyone's sound is unique and different. And everyone's anatomy is unique and individual, which is what makes comparing yourself or trying to copy another person's sound not the best idea, and potentially even bad for you, dangerous to the larynx. What you can learn to do, however, is to improve your individual posture, your breath control, and your phonation. So, the generator. Let's begin the journey with our own generators, the diaphragm, the lungs, and the abdominal muscles. And you're going to have to bear with me for just a second, because I'm going to be switching now to share my iPad screen with you. And I'm going to be using an app which I love. I use it normally to explain to my patients what's going on inside their bodies. And you'll have to excuse me because I can hear my cats fighting in the distance. And one second. Okay. Cat emergency availed. Okay, so I'm assuming you can all see the screen. If anybody can give me a thumbs up, that would be great. Great, fantastic. So we can see here on the screen the skeleton. And what I'm going to do is to add a few things to this skeleton. You can see here in the center of the screen the rib cage, which houses and protects the lungs and heart. We can see the lumbar spine, so we can see the whole spine. You can see the lumbar spine and pelvis. If it's helpful for you, I will actually just draw that. So here's the lumbar spine down here, pelvis, and here we've got the bony rib cage at the top. And then what I'm going to do is just add a few body parts. So let's add the respiratory system. Let's add some musculature. So here I've added the lungs and the diaphragm. In fact, I think what I'll do, just to single it out, make it easier for everybody to see, is add the respiratory diaphragm. But I'm also going to add what's known collectively as the pelvic diaphragm, or the pelvic floor, as most of you will know it. And what's interesting about the pelvic floor is that it looks quite similar in shape to the diaphragm. You can see they almost look like an upside down version of each other. So this muscle here is the diaphragm, and it's our main breathing muscle. And you can see if I turn it around like this, that it actually is a dome, or we often call it a jellyfish or a parachute shaped muscle. I think it also looks a bit like a saddle. And it's shaped like that because underneath you have on the right-hand side, which would be the left-hand side of the screen, of course, we're talking about anatomical right, the liver tucked under, actually, I can just add the digestive system. You can see the liver is actually, some of you might be a bit squeamish, sorry, I am quite desensitized to this stuff, so I apologize if some of you have just had your dinner. But here you can see the liver. I assume you can see this pink here, and you can see the stomach here. These are tucked up underneath the diaphragm. And it's important to bear that in mind, how close and attached everything is to one another. And you should think of the diaphragm a little bit like a double-sided sticky tape, because above it is stuck to the lungs, and underneath it is stuck to the peritoneum, which is actually a layer which surrounds the entirety of the abdominal contents. The next point I wanted to make, which is important, is to remember when we're talking about singing and breathing and the movement of the abdominal and thoracic cavities, or the digestive system and the respiratory system in relation to the diaphragm movement and contraction and relaxation, is that the body is divided into cavities. And I'm going to have to switch now to share with you my screen on my laptop. So apologies, this is where it gets a little bit clunky, that I have to switch off and switch back on. But we have these body cavities. Can you see this? I'm going to ask someone. Great, fantastic. So here we can see on the left-hand side of the screen, this side view cross-section through the body. And it's a simplified diagram just to illustrate this point that we have a thoracic cavity, which is within the rib cage and houses, as I said, the lungs and heart. And we have beneath the diaphragm, which would exist in this space here. It's labeled on the diagram. Beneath that, we have the abdominal cavity, here represented in pink. And then they've actually separated the pelvic cavity, although I would correct that and say that these two cavities are continuous. Now that's relevant because when you breathe in, most of you will be familiar that if you're breathing in with a diaphragmatic breath, the diaphragm descends. So this is how breathing occurs. The diaphragm contracts and that parachute starts to get pulled down. So if you can imagine the parachute being pulled down and flattening, and because it's a double-sided sticky tape, it brings down the lungs with it, which then expand. And it's a bit like the bellows that you would have in the old days by the fire. As you open the bellows, or if you open an accordion, it creates a vacuum that sucks in the air. And at the same time, what's happening is, as the diaphragm is pushing down, the abdominal organs are being displaced. So as I showed you, you've got the liver, and you've got the stomach, and you've got all of the bowels inside. Those are being pushed down, and that causes an outwards bulging of the tummy. Now, the reason I'm going on about this in particular is because often in singing, and I'm going to keep bringing it back to singing, one of the things, and I personally suffered from this in the beginning, is tension in the abdominal wall. And this also relates to my work as a chiropractor. Many low back pain sufferers, but not just low back pain sufferers, we have Hourglass Syndrome. And as a society, I would say many of us have Hourglass Syndrome, which is this desire to suck in the waist effectively. And if you're a singer, this can't happen, because if you're sucking in the waist and you're contracting the abdominal wall, you're restricting the natural outwards protrusion of the abdominal contents with breathing. So what's going to happen is you're going to create resistance to the descent of the diaphragm. So the diaphragm's trying to contract, it's trying to fill your lungs with air, which would naturally push your abdominal contents down and out. So they would protrude a little bit like this. If you follow my cursor on the screen there, they would protrude naturally like that, which is a natural thing that should happen. But at the same time, we don't want to look fat, or we don't want to look too curvy. So we hold our waists in. And the result might be, for example, a lack of full inhalation, a lack of sufficient air to carry you through the passage from start to finish, and you run out of air. So if this might happen, I know it happened to me in the beginning. I was so used to wanting to look like I had a six-pack. So my teacher found it worked a lot with me to relax my tummy and be comfortable looking fat, which took me a long time. Now I've taken it to the extreme, especially with lockdown, and I call it my opera belly. But my other half is not such a fan. But anyway, understanding the relationship between the cavities is really helpful when you're singing, and helps you to understand the importance of needing to relax the stomach to allow that inhalation of air. So I just wanted to show you that cavities diagram there, because I think it can be very useful to have that concept in your head. So I will then go back to my, iPad in a second. Let me just check that I want to make sure I don't wander off track, because I love to waffle and I don't want to bore you. Oh yes, I wanted to show you a little diagram, just to, again, actually an animation to show you. So I'll just share Google again. I assume you can see that. And I'm going to, if I make it larger, do you still see it? And is it filling the screen? Great. So if I press play, I don't want sound. I just want you to see this very basic, simple, quite pixelated animation of the diaphragm contracting and relaxing. So you can see how it changes shape when you breathe in and breathe out. Breathe in, it's down. Breathe out, it goes up. Remember, when it contracts, it goes down. And when it relaxes, it goes up. So actually, the upwards movement is just a letting go of the diaphragm, just from another angle. So you can see, and you can see the natural movement of the rib cage expanding and again contracting as well. So this happens every time you breathe, singing or not singing. And when you're relaxed, you only need to use the diaphragm to breathe. We don't need any additional muscle force. You only need extra muscle activity when you need a great big breath like that. Now that's dangerous in singing, because if you do that, you use, as you can see, these neck muscles, and that causes tension, which pulls underneath the chin and pulls on the larynx as well. So that ability to relax your abdomen and let everything kind of just drop, really, to allow the diaphragm to drop and the abdominal contents to drop, will help you to take a breath in more effectively and efficiently. Oops. So let me just close that. I've got a diaphragm on my screen, breathing away. Oh, good, it's gone. I thought I was going to be stuck with the diaphragm there. Okay, so hopefully that all makes sense. So, as I said, problems can occur with people holding in their stomachs. Now, I did do a run through with Trisha, and she assured me that it was okay to do this. So I'm actually going to do a little demonstration. And we're going to talk a little bit about posture, because as I'm a chiropractor, I love a bit of posture now and again. And it's one thing to relax your abdomen, but what we don't want to do is to relax everything completely. And we all know the importance of having good posture when you're singing. So for this mechanism to be very effective, what we want is not for you to relax so much that you slip into this posture. A lot of people will naturally, when they're completely relaxed, go into this forward tilt. And you can see, if you focus on the waistband of my trousers, how it goes from horizontal, which is a correct position, if I'm activating the right muscles, to this. So when I say relax your abdomen, I don't mean relax absolutely everything. And it's about trying to isolate, to use your buttock muscles to tilt the pelvis to a more horizontal position. And if you look in the mirror, you can just compare and see where your belt line is, but it should be roughly horizontal. Now, women have slightly more pelvic tilt anteriorly generally than men, not all of them, but in general, anatomically. And the way to reduce it or to get a more horizontal pelvis is to use your buttock muscle. So a little clench of the buttocks, and then keeping this clench, you can relax this, okay? What we don't want is that you're singing like this, okay? With his tummy sucked in, because my diaphragm will try to come down, but I'm pulling in. So it's going to be pushing down and it's not going to be able to descend. So we need to let out. And you can hear how I went, yeah, that's natural. I'm not sucking the air in. It's just coming in as I relax the abdomen because I'm allowing the diaphragm to go down to where it wants to go. So bum activated, pelvis horizontal or neutral, which is this horizontal belt line more or less. Of course, everyone's anatomy is different. Then relaxed abdomen. So be comfortable looking a little bit fatter than perhaps you really are. But if you are extended through the spine, then you should be able to relax. And it doesn't look as bad as if you're slumping. Okay, so nice and tall, bum activated, pelvic tilt, relax. And now you can breathe in. Watch my hand. Okay, so this is a really important concept in respiratory physiology and anatomy, which is essential for singing, that I wanted to talk about today. And if this is something that you don't feel you can do on your own, you can try Pilates. Pilates is great for learning about pelvic positioning and activating muscle groups one at a time. So Pilates is something you can definitely consider, or you can speak to a practitioner, a chiropractor, or physiotherapist, or whoever. So bear in mind that if you do stand with that hyperlordotic or too arched back position, you're going to compromise your ability to breathe, but you're also going to compromise your ability to breathe out. So we talked about breathing in, but what's important with singing, of course, is breathing out, because that's when we make a noise. We don't make a noise when we breathe in. It's as the air is forced out and up and through the vocal mechanism or vocal cords. Well, if you're standing, and I'm going to just touch on this briefly again in this position, if you're standing with this back arch position, what's happening is you're contracting your lower back muscles here. And in the body, every muscle has an opposite muscle that does the opposite thing. The elbow is bent using the biceps. For that to occur, the triceps has to relax to allow that to occur. And in turn, if I want to straighten my arm, the triceps contracts and the biceps lets go and relaxes. If I contract them both, my arm just gets stiffened effectively. We have the same group of muscles in the spine, the lower back. We have our tummy muscles, which do the famous crunching. If you want to do your sit-ups, you use these muscles at the front. Well, there are also some of the muscles that you use to blow out. You can see as I blow out hard, I actually flex. But if I'm standing in this position, I'm using the muscles at the back. I'm extending. And if I'm locked in an extended position, singing like this, when I want to contract these muscles at the front, I reach a kind of dead end because I'm using these muscles. And the body says, well, you can't do both, pick one. Whereas if I put my pelvis again into that neutral position, I can relax, and now I can more fully So having a good pelvic position and lumbar spine posture is important, not just for avoiding back pain, but in singing for being able to activate your abdominal musculature, the wall of the abdomen, to force that air to come out and go up towards the vocal cords. So I think that's enough about the lower back, spine, pelvis, and abdominal muscles. Just to actually, I did want to share with you again the just another 3D image of the abdominal musculature, so you can actually see what that looks like, what they look like, I should say. Again, I just need to click on screen mirroring, and you should see my MacBook. I have fed the cats, in case anybody saw my reminder, do not worry. And then if I look at the, trying to get out of pen mode, let's clear those little pink marks, you don't need to see those. So what I'm going to do is just quickly search here for abdominal wall. Muscles of abdomen, and we're going to put them in. So they're not that color. So this is just to show you as well that you have multiple layers. And the job of the abdominal musculature is to contract inwards and to stabilize the torso. But in singing, they contract and they squeeze the air out of you in a way. You can think of it happening in that way. And it happens all the way around from front to back, which is why you have to stand in a neutral spine position. I can remove layers at a time. And you can see that for every layer I remove, it's a bit like the Russian doll situation. We have another layer. So that was one layer. We'll just take another layer away. Now you start to recognize what we normally hope to see on the outside. So these are your six-pack muscles or your rectus abdominis muscles. And if I remove those as well, you'll see there's yet another layer. So we have 4 layers of abdominal muscles. And these are the transversus abdominis on the inside. And if I remove those, you'll see that we're now inside the abdominal cavity. So these muscles act to squeeze the air out of the lungs. So we're increasing the pressure, the intra-abdominal pressure inside where our digestive system lives, and that's pushing the diaphragm up, and then that's closing the thoracic cavity and squishing the air out of the lungs with good pressure and force. And again, I said I'm not a singing teacher, but I think this has something to do with that leaning on the diaphragm, or that support that's coming from that external pressure from the abdominal wall, as well as the regulation of the movement of the diaphragm as well. At least that's how I interpret it anatomically, and that helps me when I think about what I'm doing when I'm singing. So next, we're going to move up to, we talked about the generator, and what we've discussed is really how we generate the movement of the air, or the air flow, and therefore the breath pressure. That to singers, they'll be familiar with the term breath pressure, which is something we need to learn to regulate to create the sound we're trying to create, or the feeling that we're trying to create, I should say. For those vocal coaches and singing teachers in the audience, I know you're there. So moving up to the vibrator next, what I'm going to do is actually just reset on my, just double checking, you can see still my screen, yes? So I've removed the respiratory, I've removed the abdominal wall, I've removed the diaphragm. You get that now. So I'm going to zoom in a little bit. We're going to look a little bit more at this upper part. So we have the lungs, pretty self-explanatory. This is not a lesson on respiratory physiology. They fill with air, and then we push the air out. The air escapes via the bronchioles, which you can see down there tucked away, coming out of each lung on each side, left and right bronchioles, and they join in the middle and travel up through the trachea or windpipe, to give it its layman's name, and then you can see how it reaches the larynx. So here we can see the larynx, made up of a series of cartilages, quite a beautiful, complex anatomical structure. I think it's made of 9 different individual cartilage pieces, if you like. I'm actually going to just single it out so you can see it on its own, and it's a bit easier then to float around. Here's the back of the larynx. And I understand that looking at this, it can be quite mind-boggling and think, what on earth is going on in that there? What is that there? So it's this very strange looking structure. We're looking at the back of it now, and that pink area in the center, if we look down there, that's our glottis, which is the partition between the vocal folds. So that gap you can see effectively is the space produced between the vocal folds. So this person would be would not be phonating because the vocal cords would be shut. Or should we say approximating or adducted together. So air would be passing through here. So this person might be whispering or might just be breathing. But this is what the larynx looks like from the back. We can look underneath. We'd be looking up the trachea here. And if I make it smaller and swing around to the front. So this central part here, unfortunately, I can't use the pen on this view. But actually, if I just do this, The central part is the Adam's apple, which you see usually on the man here as we swallow. This movement here is this point here. I don't know if that helps you to kind of locate yourself or locate this on yourself. And you can see that it is, so just to give you a little information about the larynx. So as I said, we follow the journey up to the larynx. It's a complex region of anatomy. And think of the vocal folds as protected within this cartilage shell or box. This voice box is probably where the term comes from. And if we look inside, as I showed you already, I'm going to just zoom in a little bit more on the vocal folds, because this allows you to see in a different way what the vocal folds look like. So you can see the relationship of, this is the area where all the magic happens, the vibration occurring at the vocal folds. This bone structure, you can see like a horseshoe shape, is the hyoid bone. It's a floating bone, meaning it's not directly attached to any other bone. It's held in place by musculature. And what's relevant about it is that the tongue attaches to it and the larynx attaches to it, which is why, for those who sing, tongue retraction can be a dangerous thing, because then what you're doing then, if you're pushing back onto the tongue, you're pushing down on that bone, and you're going to effectively dampen the vibrations that are occurring within the larynx and reduce resonance. And that's why tongue retraction, amongst many other reasons, is not a great thing for singing. But we can see how it's pinched here in the center. And just to give you an idea, the length of the vocal cords are between 12.5 and 23 millimeters. So you really are looking at a teeny weeny, you know, obviously depending if you're male or female and the size of the body, but a really, really, really tiny thing that creates such a huge noise if you think of an operatic voice. So, and that's its relation to one of the cervical vertebrae. This is one of your neck bones. So that's the little thing that when the air comes up, the cords come together and that blocks the air. But as the pressure increases, as we push harder, the air starts to escape through those folds and starts to buzz effectively. And that buzzing causes vibrations to happen in the air just above. So following that, the airflow, sorry, give me a second. Actually, I wanted to show you a little video again of the movement of the larynx during I do hope. Oh, let me see. Oh yes, it's still there. Thank God. Good. Let me see. Hopefully you can see this. Can you see my screen? Good. So if I press play, but I don't want to play the entire thing because I've just shown you the larynx and what it looks like effectively. But it's quite nice because it kind of splits the cartilages up so you can see it slightly animated, and it just labels things. These are all the cartilages that move around, and it's the movement of these cartilages actually that change the length and angulation of the vocal folds to modify the pitch. So there it is all reassembling. We have various muscles, so the muscles that are attached to the cartilages, and it's the contraction and relaxation of these muscles in synchrony which move the cartilage and therefore move the attached cords. Here we can see, I'm just going to pause it. Here we can see the vocal folds going from, this is the front of the body at the bottom of the screen, and this is the back. So they're attached to the inside of what's called the thyroid cartilage, and they're attached to the back to the arytenoid cartilage. And we'll see a little animation of what happens. Just about 1 minute. So to breathe and to allow air to go in and out, the posterior cricoarytenoid cartilages swing outwards and open and separate the vocal folds. This is for whispering. So there's a little narrow aperture you can see, or could see. Unfortunately, I can't rewind because I've got the screen share thing in the bottom, but never mind. But the important one is this one. So the chords come together, and as you can see, they start to vibrate. And it's that vibration that creates the sound. Now, to lower the pitch, we loosen the chords. You saw the movement of the cartilages here at the front. They dropped down or they moved forward, and that puts a bit of slack into the vocal cords, which lowers the pitch. The opposite of that would be to lengthen or tighten the cords, and that happens in a different way. You'll see this large thyroid cartilage will tilt. So laryngeal tilt, this is the process of laryngeal tilting that can occur. So the cords are stretched. Did you see how that moved? And that increases the pitch. So this would be a higher note that's being sung or spoken even. This could be during speaking, but we'll assume it's singing. So that's a little video I just wanted to show you. And there are hundreds of videos on animations of the larynx. You can have a look at them. But I just wanted to show you that little one, which is quite nice and easy to understand. And I'm just going to get rid of that. I did have another one as well, but I think that one's pretty self-explanatory. Good. So, yeah, as I mentioned at the beginning, the air comes through, puffs of air escape. That causes the vibration to occur. And as you saw in the video, the looser the cords are, the lower the vibration and the lower the pitch of the sound. Higher pitch require more tension in the cords. After that, we reach the resonators. So once phonation, or the act of making a sound, whether it's singing or speaking, has started, those vibrations of air begin to vibrate the surrounding tissues of the vocal tract. So the vocal tract is essentially an airspace resonator made of a series of interconnected chambers. Each of it has its own resonance bandwidth. When we sing different vowels, each vowel seems to have its own pitch. And this happens because there are areas of resonance in your vocal tract that enhance and some which dampen specific frequencies. And whenever the harmonics of your fundamental frequency of the note you're trying to sing lie close to the resonance frequencies of the vocal tract, the sound is boosted. So your sound becomes louder. And then, so that's how, by using vocal tract shaping or modifying the shape of our throat, making an open throat, changing the height of the palate, widening, creating a yawn sensation or an inward smile, or all of these, not metaphorical, but verbal cues. What we're trying to do is to modify the shape of these chambers so that we can change the resonance that's occurring inside the vocal tract. And our primary resonators are the pharynx, the mouth, and the nasal cavity. So I'm going to show you those on the iPad. Just switching over quickly. And let's see. Okay, so first let's look at the pharynx. And the pharynx is split into three parts. I'm first of all going to show you, that's the pharynx, which is changing color there. First, you have to see just how it is almost immediately connected. Well, it is immediately connected to the larynx. So here's your larynx here. You can see my steady hand there. And then you've got the pharynx here, just off the back of it. So the part immediately connected to the larynx is called the laryngopharynx. The part immediately behind the oral cavity, or the mouth, is the oropharynx, or the oral pharynx. And then the part connected to the nasal cavity is the nasopharynx. But collectively, the whole thing is called the pharynx. There is also another part as well, but these are the main parts that I'm going to talk about. And if I isolate the pharynx, it looks very strange. Again, like some creature you'd expect to see in a weird alien movie. And if I rotate, this is it from the front. So what's missing, of course, in these spaces, again, I can't use the pen in this mode, but you'll see, well, you can actually see the tonsil, or what's the uvula, which is the central dangling tonsil there. So now you can orient yourself. This part is, of course, the oropharynx at the back of the mouth. So open throat, this is what we're referring to, modifying the diameter and the length of the pharynx to modify the resonance. At the top there, ignoring what look like these slug antennae, which I believe are just ligaments, or perhaps they might be muscles. That would be the nasopharynx. And then at the bottom here, this is the bit that's directly connected to your larynx. And this strange looking aperture is where the epiglottis, which is the little tongue at the back, which stops your food going down the wrong way, that flips up and covers that gap, or drops to hide the trachea. So that's your oropharynx. And I'm going to go back to my notes. And wrapped around the pharynx, you have a group of muscles called the pharyngeal muscles. And you can see those there. I'm going to hide the mandible. You can see how complex this area really is. It gives you a deep understanding or deep appreciation for this incredible instrument that we have. And when you see just how many parts go into making that sound. But these muscles at the back here, these big muscles here, but also these thinner, spindly muscles, these are the muscles that move and modify and constrict and widen the diameter or the shape of the pharynx. As you can see, they're wrapping around the pharynx, forming a kind of half sleeve. So you can imagine if those muscles are constricting, you're going to narrow the pharynx. That's not always a bad thing. It just gives you a different quality. And if they relax, they're going to allow it to widen, give you a different quality. We're talking about things like brightness or darkness in the sound. And it's the mastery of the use of these muscles that really gives you that ability to choose the color you wish to sing in, amongst many other things. But this is definitely one big component of it, because this is where your resonance is occurring. So just wanted to show you those. Just to show you what they look like in isolation, because it's nice sometimes to see them on their own. This is from the back. You can see it's a kind of a muscular sleeve that surrounds that throat internally at the back. Also, these muscles are really important in swallowing. So they'll constrict to push food down when it needs to go down towards the esophagus or our food pipe. So, as I said, muscles can be used to narrow or widen parts of the pharynx. The larynx can also be lowered or shortened, raised or lowered, or shortened or lengthened. And that gives you, again, perceptually brighter or deeper resonating qualities. Moving up to our next resonator, I talked about the pharynx, the mouth, and the nasal cavity. I'm going to talk about the nasal cavity. Nasal cavity, there's not lots to say about the nasal cavity. It's not the best resonator in the world because it's largely made of mucous membranes. And if we just look inside the skull here, we're looking just at the left, which on your screens will be the right, but we're talking about anatomical left here, nasal cavity. I can zoom right into the nose there. Again, might gross a few people out, but I've seen this 1,000 times. Here we can see how it's covered in mucous membrane. It's quite narrow in shape. We can look at it from the front. We can look at it from behind. So this is actually inside the person looking out of the nose. It's not very often you get to see that. And you can see it's made of these very strange and irregular shaped bones. Those shelves that are sticking out, is how I like to think of them, are called the turbulent bones, and they're there to cause the air that comes in to circulate and to warm up and to become moist, and that then allows us to smell better, but also warms and conditions the air so that it goes down into the lungs and makes it less and it filters the air, of course, from incoming bacteria or dirt and dust. But as I said, the nasal cavity is not the best resonator in the world, but it is, what's interesting about it is by raising the soft palate at the back up, it closes off the nasal cavity. And that's a bit like doing that NG sound, which some of you might do as a singing exercise. And that's necessary for non-nasal consonants and all non-nasalized vowels, which occur in languages like English, Italian, and German. And lowering the soft palate that occurs in languages like, lowering the soft palate opens the nasal cavity, which gives you a resonance coupling of nasal and oral pharyngeal regions, so you get a more nasal sound quality. And nasal consonants and nasalized vowels, like in French, that mechanism is very important. Soft palate is lowered. But as I said, it's not the best resonator, but some people, like more in commercial singing or contemporary commercial singing, like to mix in nasal resonance for a vocal effect. And we're nearing the end, but I'm just going to talk a little bit about the oral cavity, which is again a very important region. It came up even though I misspelt it, which is good. Unfortunately, I can't open the mouth of the model, but what I can do is isolate it. Which, when you isolate body parts, it looks absolutely bonkers, especially when they're inside you. But you can see here, the person has a closed mouth, but you can see the resting tongue position and how close it is to the hard palate at the roof of the mouth. We can see the root of the tongue, which some of you might be surprised to see how low and long it is. And this would connect at the front to the inside of the chin bone. This portion here at the bottom, that would connect just to the inside of the mandible, just behind and, well, beneath and inside the teeth. And then, as I said previously, at the back, this portion, this cut-off piece here, is the attachment to the hyoid bone. And that's why if you're pulling back, you're going to pull on the larynx and dampen the sound or decrease your resonance. That's more or less all I was going to say about that. Yeah, we talked about tongue root tension. Finally, an area that I'm particularly interested in is the jaw, mainly because it's something that I like to treat as a chiropractor. And I actually haven't searched for TMJ, but let's see. Great, okay. Let's see what this looks like when it's isolated. Oh yes, of course, because I hid the mandible earlier. Here we go, let's put him back. And let's get rid of the digestive system because we've seen enough tongues and guts and all kinds of other things. So here, this here is what I'm zooming in on, is the temporomandibular joint or the jaw. The mandible or the jawbone here, this one I'm illuminating, forms the side and front boundaries of the oral cavity. And although you might think that opening the jaw wider will produce a louder sound, actually the jaw has an unusual hinging mechanism where firstly, when you start to open your mouth, it works like a hinge. But at a certain point, it protracts, so it will go so forward and backwards. And if you're doing that, if you're opening too wide, that can actually decrease resonance. So it's about having the right balance, really. And you can all do a little test, only for my, if for nothing else, for my own amusement. Normal mouth opening should be approximately your own middle 3 knuckles. So I'll demonstrate. So have a go, and I'm definitely going to watch you all do this. You should be able to get your middle 3 knuckles between your teeth. So just to bear in mind, it should be this way around. Now, if you struggle to do that, don't panic. First of all, jaw tension is really common and it's treatable. We can get rid of it. We can help to stretch the muscles of the jaw. But many people come to see me with jaw or TMJ issues. I've treated them in singers as well. And these often occur in patients who grind their teeth during the day when they're focusing on things, tend to grip the teeth and grind, or even during sleep at night. And if anyone has a partner who does this, you'll know about it because it's one of the most horrible sounds. It goes through, it goes through me for sure. And as I said, it's often caused by stress. And hands-on treatment can help to relax those muscles. We can massage the muscles of mastication, which are these muscles on the side of the jaw here. I should actually just check. Are you still seeing my screen? Yeah, I assume you still are. So I can show you those muscles. Like, for example, there's one of them. This muscle is called masseter. It's actually the strongest muscle in the body, even though it's not big. Its job requires that it is a strong muscle to grind and to crush and to pulverize the food that we eat. And it's moving more than any other. This joint, actually, the jaw joint, moves more than any other joint in the body, especially if you're someone like me. So because we speak, we sing, and we are constantly yawning or moving our jaw all day long. But this is the strongest muscle in the body. So if you're stressed, this muscle can often become overactive, and then that causes the mouth to become habitually tighter and tighter. And I've had people who have such bad TMJ issues, they can't brush their teeth because they can't get a toothbrush between the teeth even. So that's when it gets pretty bad. But one massage you could do for yourself is if you get your thumbs, give yourself 2 thumbs up, and then you're going to find the corner of the mandible, which is this area on the diagram here. You can palpate that with your fingertips. Then you're going to take your thumbs and contact that corner of the mandible. Now you might find that you end up salivating because your salivary glands are around here, so don't worry about that. And what you're going to do is push up as you open the mouth. You may slip off, you'll get the hang of it. Go back, close the mouth, go back to the angle, and you're applying an inwards and upwards traction with your fingertips. In, and then open, close, contact, push, open. Alternatively, you can use the pads of your fingertips and push up. Some people find that easier. On, push up, open. And some of you might find that quite painful. It might be that you've got a bit of tension in your masseter muscles. And there are other exercises. I sometimes give patients stretching their jaws to try to improve their mouth opening, but we can work on that hands-on. So that's your TMJ, or your jaw joint. And that's more or less it. So, I mean, the other thing I was going to mention quite quickly is of course, why that's why head and neck posture is also very, very important. We talked about the lumbar spine and how important that was for our posture, for our abdominal muscles to activate your glutes, but also the same thing is important in the neck as well. If you have a forward head posture, as many people have, this kind of posture here when singing, reaching forward, what you're doing, of course, is you're going to be shearing your cervical spine. And if you're as you've seen on the diagram I've shown a few times now, if you remember how close the spine is to the trachea and the pharynx and all the pharyngeal muscles, if you're doing this, remember the technique of singing is, at least in one part, all about trying to manipulate and modify the size and shape of your own vocal tract. So if you're trying to lengthen it while simultaneously, without even thinking about your head and neck posture, sticking your head forward, then, well, I mean, my voice changes even when I do that. That's just talking. You can imagine what happens when you sing. So having your head and neck lengthened and on top of the body, thinking tall and long, like you're being suspended by a string from the crown up towards the ceiling, rather than pushing up with the chin. This is not what I mean, but I don't either mean shearing and tucking the chin hard in, which I've been guilty of doing before to try to get that artificial support. Nice and tall and lengthened, and then pelvic tilting, as we talked about before, and then relaxed abdomen. But that's very important as well. Otherwise, you're going to change the shape of your resonators as well. So posture is perhaps more important than many people give it credit. So thank you so much for paying me so much attention, and I hope you found it interesting. I have probably gone on a little bit longer than I thought I would. I'm really sorry, Tricia. If you need to run off, I get that, no problem. If anybody has any questions, I will do my very best to answer them. Let me know. You can either unmute yourself and just speak and see who gets there first, or if I've said enough, then that's fine as well.
I've got a question.
Oh, who's that? Francis.
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 Is there any effect on the apparatus and the voice if you have thyroid problems?
That's a very good question. I can't answer that question, to be honest with you. The thyroid gland is located around the thyroid cartilage and is definitely intimately anatomically connected location-wise, but thyroid problems being hormonal in nature, my understanding is that they can affect the mucous membranes of the body. So it wouldn't surprise me, but I can't answer that. I'm not really qualified to answer that, unfortunately. It's not my speciality, but it's a very good question.
Thank you.
Ooh,
a couple of questions are coming up on the chat, actually, Owain. Can you see them?
Oh, yes, I can, yes. Sarah, is it possible to treat patients who are singers of any type who have difficulty relaxing their tummy muscles, and have you treated asthmatics at all who can sometimes have trouble breathing out? Yes, is the answer to both those questions in a nutshell. In fact, we were talking about asthmatics, very fascinating, today at my clinic. Yes, definitely. So this is what I was saying. My work as a chiropractor overlaps a lot with what I've learned as a singer. That inability to relax the abdominal muscle was something I had to learn myself. So there are definitely guided exercises that I would normally go through with my patients in the clinic on the bench if they have an inability to relax those tummy muscles. Yes, definitely is the answer to that. Yeah, I have treated asthmatics as well. Not specifically because they have trouble in breathing out, but I've seen the effects of the asthma on their breathing patterns, and I've worked with them in improving those. Pam, a request. Could you please show us the sternocleidomastoid muscle on the app? Yeah, absolutely. Good old sternocleidomastoid. Yeah, big muscle in the front of the neck, involved in flexion and rotation. Let's look at the left one. I think if I isolate it, it should still give me the bony attachments, yeah. So I don't know if you're happy to see it in this way. If I show you on myself, if I look to the left and down slightly, this is sternocleidomastoid. And if I turn to the right, sorry, you can see it there. So it's a flexor and a rotator of the neck. And it's very important because when you, or when one has a forward head posture, it is usually, as you can probably see, partly at least the sternocleidomastoid, as well as the suboccipital muscles at the back, which cause this kind of chin poking posture. So yeah, the sternocleidomastoid is an accessory breathing muscle, meaning when you need extra oxygen, it contracts and lifts the clavicles and sternum, and it helps out in breathing. But it looks like that. And if I put it back in the body so you can see it in context, there's the muscular system. It's living underneath this platysma. If I remove platysma on both sides, you can see both sternocleidomastoid. It's this muscle here. Is that enough? Do you understand? Not to understand. Is that sufficient? Or?
Yes, I'm sorry, I just unmuted myself. It's great. I just wanted to extend the question a little bit further, if I may. Often see in some singers the muscle protruding.
Yeah.
Is that, do you think, some sort of false support, or is it to support a not very well aligned posture? And is it better if this muscle is not particularly involved during phonation?
Yes, I think it should not be so involved, in my opinion. It is partly, as I said, a cervical spine rotator, and it is partly an accessory breathing muscle. I would like to see the same person singing before and after with an improvement in their posture, trying to think tall and long and tucking the chin in slightly and see if that changes things without tucking hard, like they're trying to hold something there. Just bringing the chin back. Usually it's involved in head poking posture. So I would think that it's probably restricting the singer in some way. Good question. Another question, let me check. There was another one, I believe. Maybe there wasn't. Oh yeah, header. Didn't get what the normal mouth opening with the knuckles referred to. Rest, singing, max opening. Max opening. Yes, range of motion. So one's maximum, not maximum, but yes, normal mouth opening, meaning how much one's mouth should be able to open, is defined as 3 knuckles. That's supposed to be what we can all achieve. You all put your hands in your mouths. It's I'm not laughing at you, but I'm kind of laughing at you slightly. I love it. So if you can get 2, you might need to do some of this massage. If you can only get 1, you definitely would need some treatment, in my opinion. I mean, you know, you've always got that friend who can do the fist in the mouth party trick. I know I have. I could do 4. That's my party trick, but 3 is expected and normal, considered normal. Any other questions? These are great questions.
Just on that,
yeah.
I was told that, like, if you, I know you said before not to lift like your head, but
yeah.
like how that also opens of the jaw for like the sound. So, but I don't know if the thing is like, I don't think I'm making any sense. If the knuckle thing equals to, instead of lifting your head, kinds of lift the top of the jaw as well.
So there's a relationship. No, it's not. You are making sense. There's a relationship between cervical spine movement and jaw movement. Most of us will, without thinking, when we open our mouths as wide as we can, if you watch my head movement, we go.
Okay.
Yeah. So you'll extend the neck to give space and to allow the mouth to drop. Usually we do that without thinking. To get more mouth opening, often we will compensate with the neck, which is why often people with neck problems get jaw problems and people with jaw problems get neck problems. The two are related. I would say that in a normal upright posture, if you can open your mouth, I don't need to extend my cervical spine to do that.
Mm-hmm.
You should be able to do it without. The other thing that came to my mind when you were asking me that question is that many people, like myself, actually, one of my main errors is that I tend to sing like this to get some artificial support here. And I'm trying my best at the moment to extend my neck slightly, deliberately, to look ever so slightly upwards, because it stops me from pulling downwards. So I don't know if that really answers your question 100%. Does that help?
It helps. It helps. Yeah.
Okay. Do you want to rephrase it, or ask me again, or say it in a different way?
I don't know, like, because basically, I've like just finished like my acting course or whatever, and we had done a show, and obviously in the voice department in our school, they like the same amount of breath you take to sing is like the same breath you need to take for theatrical text and stuff like that. And because we was in a theater space with like high ceilings, she said that we needed to lift up like our heads a bit more, so the top bit of our jaw could like make the sound a bit more bright, or like, I don't know, more up than forward because of how big the space was.
Okay.
So I was just wondering, in terms of like what you said before about not lifting your head, if the 3 knuckles was an alternative to lifting the jaw instead of literally facing your, I don't know, your side of it upwards.
Okay, I think I understand a bit better. It sounds to me like they're 2 different things.
Okay.
And I feel like if I was to comment on what your tutor was asking you to do, was it your tutor?
Yeah.
I'd probably be venturing into territory that I shouldn't be, and I would follow what your tutor is telling you. I'm purely talking about the anatomical function of the jaw and what is supposed to be in, you know, what one should be able to expect their own jaw to be able to do. So all I'm saying is that normal mouth opening in a regular posture But to be honest with you, with the head extended or not, should allow for 3 fingers to fit between your knuckles. I can't say whether or not that would be a useful compensation for a larger theatre space. It's not quite my speciality. So you can mention what I've said about mouth opening to your tutor, and they'll probably have a better answer for you than I will.
Thank you.
So sorry about that. I hope that's helpful in some way. I think I saw something else coming up in the chat. Just going to check.
Oh, is that my turn?
Yes.
Oh, am I? Yes. A couple of very short questions. One thing is that I was told by my dentist, I've had trigeminal neuralgia for many years, and it began after some dental treatment. And I was told by my dentist at one point that I'm also a singer, that the voice you use for speaking and for singing come from different places or are very different. And I was also told that singing would help my trigeminal neuralgia.
Wow. I mean, I love that. I'm not someone who, I know about trigeminal neuralgia. It's a very painful condition. I'm sorry that you suffered with that. I have no idea. I have no idea if singing is helpful for trigeminal neuralgia. Have you found it been useful?
Well, the thing is that the medication I've been given has never helped, apart from make me into a sort of zombie.
Right.
So
Yes.
I have tried to do other things like exercise or whatever. And so I'm not sure, but I always feel better when I've done some singing. And even when I couldn't speak to people, I found I could sing.
I love that. That's wonderful.
It hadn't affected my voice.
That's wonderful.
Yes.
I would say that it's the same apparatus that you're using to speak and sing, but you're using them in a different way. So I'm not sure what your dentist meant specifically with regards to using a different technique to speak and sing. Well, it is a different technique to speak and sing, but it's the same chords and it's the same generator, vibrator, and resonator. And I find that fascinating with the trigeminal neuralgia, but again, it's not an area that I can comment.
Yeah. Could I just say one other thing?
Yes.
I had a stroke 6 years ago and a brain hemorrhage. And the one thing that came out of it that was good was that my trigeminal neuralgia disappeared overnight.
Oh, wow. How amazing. How amazing. Well, a silver lining, I suppose. That's a very, I'm sorry that you've been through so much. It sounds.
As a chiropractor, do you help trigeminal neuralgia patients?
Not generally, no. Not generally. There are chiropractors who specialize in neurology, neurological conditions, who might, but not in my remit. Not in my remit. I'm more exercise rehabilitation, breathing, posture, that kind of thing. But I can look for you if you'd like me to find one. I guess you're all right now, though, are you?
Yeah. Well, it's much better, but I still get attacks.
Okay. Well, thank you for your question.
I tried to put something on the chat about grinding teeth, and I'm the worst possible day and night grinder, and of course it hurts and everything. Could you suggest more exercises? I like this, and
yes,
some shiatsu as well. But could you?
Yes. I absolutely can. What I'd like to do for you is to send you a collection of exercises, and I'll send you a link to the app that we use at the clinic where you can download for free, and I'll give you an access code with a collection of jaw exercises for you to have. My email address is in the chat room. If anybody else wants to ask me any personal questions or clinical questions which are based on their own individual symptoms and medical history, I'm very happy to answer those and give you some advice, or in your case, Marie, I'll send you a little program.
Thank you.
No problem.
Thank you very much.
You're very welcome. Anybody else? This is from Kate. Can I ask you if you have some exercises you could recommend for helping to relax shoulders and neck area during a vocal warm-up? Thank you for your help. Yes, I do. I will send them to you now. We have a Backspace. Backspace is the name of my clinic in Clapham. We have a YouTube channel, and on there I've got a host of exercises and stretches. This I'm going to send into the chat room now. Here we go. This is a routine you can try. Oh, sorry, I've sent it privately to Jackie. I'll send it to everybody. Jackie, every morning, one side of my jaw clicks very loudly. Not necessarily serious, but I would happily talk to you as well. Catch my email address in the, I'll write it once again because it gets lost in the stream. Most of you have come across this webinar via St. Paul's Opera or via my own Backspace Chiropractic page. So you can find me if you need to again. But my email address is owain@thebackspace.co.uk. It's Owain, O-W-A-I-N. And happily, like I said, answer any of your individual concerns with your symptoms one-to-one. And I believe that's the only thing I haven't answered. So,
I think Peter and
yes.
Sarah asked about tongue tension.
Oh, sorry. This may have been touched on already. Is it possible to talk a bit more about tongue tension and what contributes to this? You know, this is a difficult one for me to answer. Again, unfortunately, I think tongue tension is, as I understand it from my own personal experience, often an attempt to gain some kind of secondary support when you're trying to attempt to do something else, probably when you're trying to modify the shape of your pharynx. In fact, Pan, who's possibly still in the audience, maybe he's needed to run off already, might be better than I am at answering this. But tongue tension during singing, that retraction of the tongue backwards, is often what people are doing is they're pushing down on the larynx to help it to lower. What we're trying to do is to lower the larynx, but we're doing it using the tongue. So we're mechanically pushing it down using pressure from above, or that retraction, that pushing back of the tongue on the hyoid bone, rather than using the infrahyoid muscles, which are the muscles below the larynx, to pull it down, as happens when we yawn. You can see my larynx going. If I simulate a yawn, you can see it's those muscles we should be using, not my tongue pushing back. So my experience from being someone who's done this and still does this, and often in men, it's because we're trying to create a darker sound. So we push back on the tongue, and that makes a more dark, resonant sound. But it's not. It's actually at the expense of true resonance, where the sound is going to carry. It's not going to. So you'll hear it yourself, but they won't hear it in the audience. So other reasons which are non-singing related for jaw tension, tongue tension, I couldn't give you many more causes, to be honest, because I don't treat the tongue, but I do treat the jaw, and stress is often a cause of jaw problems, but not necessarily tongue problems as far as I'm aware. It's probably something more to do with technique, and so the singing teacher is the best person to talk to about that, as always, when it's related to, if I assume, related to singing. So, lovely. I think that's everything. Thank you so much, everyone.
Thank you.
You're welcome. And Tricia, do you have anything you'd like to add or say, or?
I'd just like to say an enormous thank you. Obviously, loads of people have really enjoyed this, and a tremendous turnout from everybody. But thank you for involving us, St. Paul's Opera, in a really fascinating evening. And thank you very much, Owain.
You're very welcome.
Thank you.
Shall we all
Owain.
unmute our microphones and give Owain a round of applause?
Thank you.
Thank you so much. Thank you. It's been a pleasure, and I hope to do it again in future. So, okay, thanks so much.
Thank you very much indeed.
I'm getting shy here. All right,
Owain, one thing before everybody goes, can you just confirm that if people are late to the broadcast or have missed it, I've just seen something on the chat that perhaps there was a confusion of the start time. It's possible to rerun this on Facebook, yeah?
Yes, it should be the case that it has been broadcasting live in theory.
It has, I've been watching.
Oh, phew. So it will, after I stop, it should then automatically save to the wall. I will do my very best to make sure that happens, because what I can see is that I didn't, unfortunately, record it on Zoom. So fingers crossed. I can see it's playing on the wall still. So hopefully, yes, it'll be there. Okay.
Excellent. Thank you so much.
Thank you.
Thanks.
No problem. You're all very welcome. And thank you so much for tuning in, and have a lovely rest of your Wednesday.
Thank
all
you.
right. Take care, everyone.
Bye.
Bye.
Bye.